Welcome to our YouTube channel of Trishla Foundation. Our main objective is to provide all the information related to cerebral palsy based on scientific facts. If you like the information from the video available on our YouTube channel and want to keep an eye on all the latest updates, then please subscribe our YouTube channel of Trishla Foundation. Good day. The greeting from Trishla Foundation. All the parents and therapist specialists are welcome to our YouTube channel of Trishla Foundation. Today we will be talking about very important problem in the cerebral palsy, that is the absent neck control. That means poor or absent neck control. Because everyone knows that if neck control is not there, we can't get good developmental milestone in the children. That is the initial part of any developmental milestone in any children. Initially, I will start with the introduction that why neck control is important. As you know that every babies are not born with strong neck muscle. It's developed with the time. Typically developing babies, that is normal children, are considered to reach a neuromotor developmental milestone around 3 months of the age. By 6 months of age, they will have nearly normal control of the neck and head. As you know that head is the main area where lots of sensory organ, mainly related with the visual for seeing the object, vestibular system, that means system for the control of the balance, hearing mechanism are embedded in the head, making refined head control for the critical importance for both orientation and the balance. As you know, the delay in neuromotor developmental at this very earliest stage of development are likely to have negative influence on the development of subsequent neuromotor skills. So it is very important to have good neck control before you start up any therapeutic modalities, any activities like crawling, creeping, standing, walking. That is, it is the precursor for all the developmental milestones. So, what is the head control? The different scientists have given different definitions. First of all, Bannerman has defined the head control as the ability to keep head aligned with respect to the gravities. Bobart, who is known about the neurodevelopmental therapy, that is most commonly method of therapy used in cerebral palsy, described the head control as the ability to maintain head in space with face vertical and mouth is horizontal. Surgeons recognize that lack of head control is often first sign of abnormality in children with atypical developments. That was the definition of the head control, why it is important. Now we should know why it is very important. Because head control is important step for the vision tracking. Because vision, eye is stayed in the head part. So head control is very important. Then child will be able to track the different objects in the environments. Head control is required to improve the coordination between the jaw, tongue and lips that affect swallowing and chewing. Head control also influences respiratory controls and speech. The head control provides support to girdle for the hand function. As you know, that upper extremity function is dependent upon shoulder girdle, and head control is provide base for the control on the girdle muscles. It is also very important prerequisite for the other function, advanced function like rolling, sitting, reaching. Good head control lay the foundation for the development and refinement of the milestones. Attaining hand control used as the starting point in therapeutic intervention for children with cerebral palsy. So, by this, all this thing, we should be very clear why head control is very important. In normal developmental child, as you know, that muscle in the neck are weakest at that stage, as I have told you earlier. At the 1 month of age, they start attempting to elevate the head in different direction while lying on the stomach. But at the age of 2 months, baby start raising the head when he has lie down and able to hold for some seconds. At 4 months, able to hold head and while lying on the stomach and raise it in a good degree. At 6 months, he will have a very good control on the head when he is sitting upright. So, persistent head and poor ability to lift head beyond the age of 4 months has been seen that it is a link to the very poor motor outcome that is happen in most of the children with cerebral palsy. And it is the fact, if neck control is not achieved at the age of 1 year, even with intensive therapy, then chances of independent walking is unlikely. It can happen due to the many reasons, and in cerebral palsy, it happens because of severe brain injuries. Now, we should know that what are the causes which causes the lack of the head control. First of all, it can be temporary only, that is a physiological up to 3 months of age. And in cerebral palsy, it is happen because of severe brain insults. Sometimes occur because of also of the neurodegenerative disorder of the brains, chromosomal disorder, cerebral dysgenesis, that's malformation of the brain, CNS infection, including the meningitis and encephalitis. Even in hypothyroidism, where thyroid level is down the child, in cervical spinal cord injuries, hypomyelination neuropathy, that is congenital variety, and in some cases of hydrocephalus, where head size is big, and even in achondroplasia, where size and weight of the head is very high compared to the normal children. In myopathy, just like congenital myopathy and spinal muscular atrophy, head control may not be there. If there, it is a poor one only. Now, I have seen that many varieties of causes can cause the absent or poor neck control. But in each variety, what are the etiopathogenesis? Why head control do not occur? It can happen because of reduced tone, that is the hypotonia. It can also happen because of reduced motor control. And muscle weakness if there, that can also cause the poor neck controls. Abnormal movement pattern, vision impairments, poor vestibular control, and asymmetric posture. All these reasons happen to cause the absent or poor neck control. When child have poor neck control, there can be many symptoms. Child will be unable to look in certain direction because of poor tracking of the vision, because his neck muscle is not working properly. He is unable to support own head, and child prop head on a surrounding object whenever he is sitting, sometime on the shoulder of the parents and sometime on the tables. Child find it difficult to move the head in particular direction when he wanted to see on that directions. Because of poor neck control, he can have lots of drooling, speech problem. Because of also that swallowing problem will be there, so that nutritional deficiency in the child can occur. And overall developmental milestone will be slowed, like crawling, creeping, sitting, knee walking, everything will be slowed, because neck control is the basis of overall tongue control and other activities. If head control is not there, how to scale them? What are the grade of the head control? It can be 0, there is no response at all. Grade 1, just initiation of the head control, but unable to lift and hold the head upright. Grade 2 means he able to hold, but only for seconds or partially. Grade 3 means mature response. These all 4 responses in the head control have to be seen in the child, so that we cannot increase from grade 0 to grade 3. But if child have grade 2, we can do lots of intensive therapeutic activity. By that we can improve the head control. All these head control activities scale has to be seen in supine, prone and supported sitting position, so that we can identify what is the basic problem and how much we can do and what will be the goal in next 3 and 6 months of the time. After this discussion, we have to make assessment why head control is not there and what is the grade. That can be done by the assessment of the tone and power in the child, in neck muscle also, what are the size of the head, presence of the abnormal movements in the child, persistent of the primitive reflexes that also can cause the absent neck control, sensory assessment because deficit in the vision, hearing, vestibular can cause lots of the head neck control problem, assessment of the speech and swallowing that is associated with poor neck control, postural stability and tongue control, spinal deformity, and what is the GMFCS level of the child 1 to 5. We have to grade them. Now, after all this assessment, what are the investigations required for the assessment of the neck control in the cerebral palsy children? We can have the ultrasound, but ultrasound can identify brain insult in very early age infants up to 2 to 3 months age. After that, it is not possible to scale down the degree of brain insult, and that time MRI brain is required. Sometime you are thinking about the thyroid deficiency, we have to check thyroid level in the blood, serum creatine phosphokinase for the muscular dystrophy, and sometime in ionic imbalance in the body like sodium, potassium, calcium deficiency, child can also have the poor neck control, but it is the very acute problem and child is very ill. Now, after seeing all this discussion, our parents are always concerned how we can get the neck control, what will be the basic of the neck control. That is very important for all the therapists and parents. As you know that brain mature in cephalocaudal direction. So, neck holding, control in the neck and head came first, followed by the control in the girdle and trunk, then extremity in that order. So, the neck muscle will be strong early before the trunk, then the shoulder girdle, then the extremity. Whatever activity we have to do in that order, so strengthen the neck muscle so that proper control in the trunk and neck can happen in the time being. As you know that if trunk control is poor, then erector spiny muscles will be weak in upper back. So they will be unable to work and neck control will not be there. One of the primary goal of the postural control is to stabilize the head space, and neck control is the foundation for the milestone. So we need to work hard in getting the neck and trunk control in place of general exercises. Whenever we see the lots of parents are coming with their children at our foundation from many part of the world, even by the online consultation, most of the time they are undergoing general exercises, lots of work are being done, our hands and leg and extremities, lots of general exercise including stretching, joint mobilization, pumping movement on the ball. But no one is bothering about the neck or trunk. As you know, neck and trunk are very important. That is the foundation for the developmental milestone. So that every parents are requested to stop all those general exercises and start focusing on control of the neck and trunk, so that they can achieve developmental milestone in a time when this child is really required in place of general exercises. What are the goals in attaining the neck control? Our primary goal is cerebral palsy to achieve the good head control, but sometimes it is not possible due to lots of reasons, just like the severe brain insults, muscular dystrophy. Then we should not be disheartened. We can utilize assistive devices for same purpose. We should start concentrating on other abilities of child by involving him or in activities of daily life with focus on education and postural training for use of wheelchair and CP chair. So that in first part of this lecture on neck control, I have given lots of info about neck control, why it is happening, what are the causes of absent neck holding, what are the basic of treatments, and what are the goals. Every parent should know why your child don't have the neck control, what should be done, what the investigation is required. In second part, we will discuss about the treatment process in the neck control, how we can improve the neck control. Thank you for hearing this YouTube channel on neck control.
सेरेब्रल पाल्सी में अधिक जानकारी के लिए हमारे YouTube चैनल त्रिशला फाउंडेशन और J999 को सब्सक्राइब करें।